a few. But February is Heart Health Month and Go Red for Women. We all wore our red, as you know, on Go Red for Women Day last Friday, I believe. But it's not just 1 month a year that we got to be concerned, because right now we're joined by Dr. Odaimi Quesada, Odaimi, I want to get that right. Odaimi Quesada, Medical Director, Women's Heart Center at the Christ Hospital Health Network. Today talking about a form of heart disease that just may go undetected. So heart disease is heart disease, but we have different levels, right?
I think what's important to know is that there's actually sex differences when it comes to heart disease.
Wow.
That we're finally starting to recognize, because we're finally starting to study women with heart disease. We used to think that women were just little men, and so we used to study heart disease in men and thought that we could just apply it to women. But now we're recognizing that there's a lot of important differences when it comes to heart disease in women. I
would imagine that hormones and muscle differences also play a role in that, because heart disease looks different in women than in men. Men always have a lot of times that classic crushing chest pain, while women's symptoms can be a little more subtle. Maybe it's just shortness of breath, but a lot of women, you've got kids, you've got families, you might have fatigue, nausea, discomfort in the back. Well, this can all be just signs of being a mom sometimes.
Or it could be a sign that you're having a heart attack or a stroke, which are very scary and things we don't want to miss. But that's a great point. You express differences in the way people present with heart disease or certain heart diseases.
Yes.
But to your point, when you brought up the issue about hormones, we know that women have a very important life cycle. Some of them go through pregnancy, they go through menopause, and we're learning that things like adverse pregnancy outcomes like gestational diabetes or preterm delivery or high blood pressure in pregnancy all increase a women's risk of heart disease later in life.
So some of these different sort of coronary, the micro events that can affect the blood supply to your heart. I know my mom, she had many different heart operations, different varying levels, but TIAs were a common thing. We were in church one time, and I remember the look that came over her face. Her eyes were like this big, and I'm like, Mom, and she was not reacting. It only lasted a couple seconds, but terrifying, and we took her to the ER right away.
Yeah, so one of the things that I specialize in, and one of the reasons we started the Women's Heart Center, is because there's certain diseases that are more common in women, and what you're describing is called coronary microvascular disease. And in fact, women more commonly, but it can happen to men too, they can have chest pain and symptoms that make you think they're having a blockage in one of the large arteries. But when you go do the test, when you go looking for obstructive disease, you don't find any. But these are patients that are telling you, I have horrible chest pain, they have a miserable life, and they're told that they're crazy, that their chest pain is anxiety, they're giving anti-anxiety medications. And the reality is that these women, the majority of them actually have disease of the tiny little vessels in the heart that we don't recognize. So they require specialized testing.
All right, so you guys have the test there at the Christ Hospital Health Network. Where can we go to get more information and come see you? Because it sounds like it's not a traditional thing to look for, and you're not just tired, you're not just stressed out, you might have something more serious sitting there.
Yeah, correct. So the Christ Hospital Women's Heart Center, you can look us up online, and we are teaming up with the American Heart Association always to bring awareness about heart disease in women, and the AHA website is another great source to learn about these sex differences.
Dr. Odaimi Quesada, always a pleasure to have you on.
Thank you.
And learning more about what our women need to do to stay strong and healthy. And someone